Thank you so much, Jen, for introduction. I will start my presentation and then Sophia will follow. So let me share my screen. Okay, give me one moment. Okay, thumbs up if you can see my full slide. Perfect, thank you so much. Thank you for the invitation to present today. I will be talking about the diversity supplement that I received to my R37 to support the career development and training of Josheili Llavona-Ortiz, who's here with me and will be talking in a moment. I'm really excited and proud about this supplemental project. You all know I am from Puerto Rico. I have a Hispanic background, and I'm very proud to almost 2 years ago recruiting Josheili here to our PHS program, and she's the very first female Hispanic student in our doctoral program. So that was a big accomplishment, and I hope that we can continue using tools like diversity supplements to continue recruiting more minority students, not only in the doctoral program, but also other type of trainees like postdoc and junior faculty. I will focus the first 3-4 slides talking about the diversity supplement mechanism with a specific focus on doctoral students and R01 or equivalent grants. Sophia then will just focus on the mechanism more specific for postdocs, okay? So what I mentioned that for the candidate, each candidate can receive one diversity supplement per career level. And what that means is that in the case, I want to put Josheili here in a spot, Josheili is receiving one right now, right? As a doctoral student. If she goes to another institution, she can receive another diversity supplement as a postdoc or as a junior faculty, okay? She can receive multiple, the individual, the candidate can receive multiple ones, but they have to be at different career stages, okay? So that's one important thing. We can apply for a maximum of 2 years of support. And one important thing is that the candidates who are receiving support from an agency of public health services at the time of submission, they're not eligible. So if you're receiving other type of career development grant or training grant funded through NIH, you are not allowed to submit at the same time a diversity supplement. You have to relinquish one in order to get the other one. And feel free to interrupt me if you have any question. Okay, let's continue talking about the candidate. Now I'm going to focus about the specific characteristics about the candidate. I want to mention 3 of them, and you can read more about this in the specific RFA. When we think about diversity supplement, the first thing that we think is about this one, individuals from racial and ethnic minority backgrounds. And in the case of Josheili, she's Hispanic or Latina, so that's one way to qualify her. And based on this characteristic, you can identify some potential candidates to apply for these diversity supplements. A second option is individuals with disabilities, and those are with a physical or mental impairment that substantially limits one or more major life activities. And the RFA for the diversity supplement has some specific instructions about using the ADA, the ADA law, to qualify that candidate. I'm not going into those details here. I'm not very familiar with these requirements, but that is another way that you can bring more candidates to apply for diversity supplements. A third way that you can bring is this one is very largely unused. We're not taking advantage of this third category here, and these are individuals from disadvantaged backgrounds. For this particular category, individuals need to qualify in 2 or more of the following criteria. So when I just go back a moment, for the one that I mentioned before, minority background or disabilities background, is only one or the other, okay? But in this one, the candidate needs to qualify for at least 2 of them, not 1, 2 of them. And you can see here some particular examples. Where or currently are homeless, where or currently are in foster care system, qualify for federal free and reduced lunch program, receive, for example, WIC benefits. The last one is grew up in one of the following areas, like U.S. rural area, and they have the classification there, or in a CMS designated low income and health professional area. So there are many ways that people can qualify here. I always tell people, and I have been having this conversation with Dr. Krasnowski, is what we can do in order to collect this information. We are not very good at collecting that for multiple reasons, but how we can promote these criteria in order to attract some of these potential candidates, and how we can make these potential candidates to feel comfortable sharing that information with us. Okay, so there are multiple ways here that we can attract more candidates, and I think this is a place that we should be doing better. Okay, now from the candidate to the parent grant. So let me talk about the grant application, and here I will focus on R01 level because that's the one that received an award. So at the time of the supplement application, the parent grant must have at least 2 years of NCI support remaining. NCI, again, this is my mechanism. The same apply for most of the NIH grants. The eligible grant types are listed in the program announcement, and there are multiple grants, not only R, but also U mechanisms and P mechanisms as well can qualify for this type of support. For R01 or R01 equivalent grant, that's mine, and R37, is allowed to support a maximum of 2 diversity supplement candidates. And this is because this type of grant, they have up to 5 years of funding support, so you can get 2 years and then the other 2 years of support. R21 or R21 equivalent grants is allowed to support a maximum of only 1 diversity supplement candidate whose career level is graduate student or more junior. Okay, so that is really important. With the R01 equivalent, you can go from graduate student, postdoc, junior faculty. Diversity supplements can also apply for high schoolers or college students, right? But if you have an R21, it's only for grad students or more junior people, like for example, high school or college student. So those are main difference in terms of the type of mechanism that you have. Budget and salary is specific for doctoral students. Sophia will tell more about this for postdocs. Salary should be consistent with the institutional salary policy. Salary, fringe, and tuition together must not exceed the amount allowable for a first-year postdoc fellow at the institution performing comparable work. In addition to that salary support and the coverage of tuitions and fees, these candidates receive a small money for supplies and traveling, in this particular case, $4,000 per year, but you have to justify how you plan to use that for your candidate. Josheili is getting support for 2 years, so in total she will be receiving $8,000 in the 2-year span of her grant, in addition to GA stipend, of course, and full coverage of her tuition and fees. Important thing is, as a 6-page application, it is breakdown in this format. It's pretty the size of an R21. So research plan, and you can see here summary of the or abstract on specific aims of the funded parent grant. So basically, the first page will be copy and paste from the main award. So you have 5 pages left, and then you have to describe briefly the research idea or the research project that the supplemental candidate will be doing in the next 2 years and how that is within scope of the parent award. Equally important is the mentoring and career development plan, and that has to be very specific to that candidate. Good news is that if you are looking for an example, a funded example, Josheili and I are happy to share our funded grant with you all, so you can take an example about how you can write these specific pages. This is a summary of my research of my parent grant, just to put in context before moving to Josheili's 3 slides about her project. My parent grant is a 3-arm cluster randomized controlled trial recruiting 30 primary care clinics in Pennsylvania, and my project will evaluate or is evaluating the impact of HPV echo, and this is announcement approach training to providers to better increase their communication skills about HPV vaccination using the echo model. And HPV Echo Plus, the same that I mentioned, plus sending recall notices to parents who decline vaccination. And we will be comparing these 2 interventions, HPV Echo and HPV Echo Plus versus control on HPV vaccination among adolescents. You're seeing here my consort diagram. I want to just say that we have recruited our 30 clinics, all of them covering over 40,000 patients. So we will have plenty of data. And I'm also very happy to say that we're just finalizing our intervention. We only have 2 more sessions, 2 more weeks in terms of finalizing our main randomized controlled trial. We expect to have our final outcome data in August of 2024. With that being said, I want to say who are the mentors of Josheili. So this is a dream team, not because of me, but because there are 2 people that are helping me here. Dr. Ben Foulds, most of you know him. He's a pediatrician, very well known in terms of HPV vaccine communication. He is part of my patent grant, the R37, and we also have LJ Vanskoy. And this is one important thing about this one. You can identify mentors who are not part of the patent grant, and this is the case of LJ Vanskoy. When Josheili and I were identifying the topic, we want to do something mixed method, including some qualitative interviews. We do not have that capacity or that portion in our patent grant, so we decided to invite LJ Vanskoy, and she agreed. So that's one important thing. You can bring expertise not only from your patent grant investigators, but also from outside. So these are the 3 people who are going to be helping Josheili in the next 1.5 years to meet the research and training goals. And talking about that, I will have Josheili just summarizing the next 3 slides about her project. Josheili.
All right, thank you so much, Dr. Calo. Can you give me a thumbs up if you can hear me well?
Yes.
All right, awesome. Thank you so much. So, buenas tardes a todos. Good afternoon, everyone. My name is Josheili, but I also go by Joshi. And as Dr. Calo mentioned, I'm the first female Hispanic DrPH student over here at Penn State. And I'm also gladly and proudly from Puerto Rico. So essentially what I want to discuss today is the diversity supplement. The plan, as Dr. Calo mentioned, his main parent grant, it actually relates to an RCT trial seeking to identify different challenges and barriers regarding announcement approaches, communication strategies around HPV. However, for our phase now, which is part of the diversity supplement, is to understand how the COVID-19 pandemic has had an impact on HPV vaccination rates. So for this diversity supplement, of course, I know most of you have already had an exposure to apply to different grants. For this specific diversity supplement, we proposed 2 aims, which were the main research aims. In this case, for aim 1, it is to characterize adolescent vaccination rates for HPV and other recommended vaccines such as Tdap and meningococcal across the COVID-19 pandemic. And when we talk about phases, we're talking about seeing the rates before the COVID-19 pandemic started, after it was officially declared in the US, but without the COVID-19 vaccine approval for adolescents that received these vaccines, and then after that vaccine approval for COVID-19, and how this sort of impacted potentially these vaccination rates. So as mentioned, it is a quantitative component, and we hypothesize that the odds of getting the vaccine actually decreased during the pandemic, and that there might be potential larger reductions among minorities because of data that has already been available through other studies. We will be using electronic health record data to analyze this particular aim, and our study population will be minors between the ages of 9 through 17 years old, and as explained, the period will be comprised from January 2019, so a year right before the pandemic was officially announced in the US, and then up until December 2022. Next slide, please. So for aim 2, we want to understand a bit more based on the findings. What does this actually mean? So essentially what we'll be asking here is healthcare providers from clinics from which the EHR data is being retrieved, how did they see these patterns regarding HPV vaccination throughout different phases of the pandemic, as I've already explained? So we want to see how have their communication changed with parents, have they seen an increased hesitancy, have these reasons changed across time, and what has been going on based on these challenges and strains that they have been going through, aside from the ones we already know. We know that healthcare providers are understaffed. We know that they've been going through a lot of challenges. We know that they have different mechanisms and approaches across the pandemic because of different bans that were in place, or not necessarily bans, but restrictions to try to avoid the dissemination of the virus of COVID-19. So we want to understand how this has changed across time. So this is mostly a qualitative component where we will be using a semi-structured interview guide. And as mentioned, these will be clinical staff from the clinics from which the data is being extracted from. So our anticipated sample is to recruit 25 staff. This includes nurses, physician assistants, physicians themselves, but mainly clinical staff, to sort of get a sense of how they see that the pandemic could have had that impact on the rates. And then I mentioned the Cohen's-Kappa coefficient, or we mentioned it during our presentation, because the sort of iterative process that we want to use, as Dr. Calo mentioned, we have Dr. LJ Vanskoy, and she'll be overseeing how well we are concording with our coding. Next slide, please. So for the training goals, as Dr. Calo mentioned, this is not only research-based, but it's also career development-based. And he and I have had conversations across the past 2 years to understand where I'm going towards and what I would like to do. And because he's been such a great and supportive mentor, he has been very receptive of all the information that I've been willing to give him of what my future steps are. And based on that, he helped me develop 4 training goals for this diversity supplement. So training goal 1 essentially is to help me understand a lot more how HPV vaccine communication and cancer prevention is being developed across time. And for that, he's also brought along Dr. Ben Foulds, who will help us identify crucial literature at this point in time to be able to understand well how HPV vaccine communication is transitioning across time. For training goal number 2, that's where Dr. LG Vanskoy comes along. She will help me further understand mixed methods approaches. And I already took her course for my doctoral program to further understand the different mechanisms, approaches, and strategies that are used to implement mixed methods research. For training goal number 3, Dr. Calo knows that I am slightly growing when it comes to writing skills for manuscripts and grant preparation. Of course, I'm a doctoral student, that's expected, and that's totally fine. So although he has already provided me a few opportunities, we wanted to really explore well this diversity supplement and help me grow as much as possible to be able to become a competitive independent researcher on the long run. And for training goal number 4, we want to improve presentation skills by participating at different meetings and cancer control planning events, not only within the state of Pennsylvania, but also on a national level to be able to build my confidence on how to communicate as a researcher. So essentially, this is my last slide, but thank you all for your attention and for being here with us today.
Thank you, Josheili. And I just want to point here, if you look at training goal number 3, this is, I was curious about this AACR workshop, not your mother's typical grant writing session, I promise. So I'm very curious about that one when Josheili take it. I want to see what is that is about. But I just want to mention my last slide now. This is a few things to consider, especially about the scale. So you have to factor this when you submit yours. And I know Sophia have a different timeline for her. It was more positive than mine, but that's fine. I submitted this application on November 30th of last year. The expected start date of the supplement was supposed to be April 1st. That was the earliest day that we can receive the funds. On May 23rd, almost 2 months after the original start date that we were supposed to get the funding, if funded, we received a notification from NCI that the application was recommended for funding. Those were great news. Okay, those are really great news, but it was 2 months after that. We did not hear in 1 month after getting that email from NCI. So on June 13, ORA, I contacted ORA here, and they follow up about the application status, and NCI personnel responded the same day, just saying, guys, there's nothing else that you can do. We're still managing this award at our end. So on September 22nd, we finally received the notice of award. So it was 5 months after the original proposed start date. And you can see here more than 3 months after the notification that we will be funded. One important thing is that the award was retroactive on May 1st. So that is a little bit of a challenge because we were just getting the award 3 months. It creates some logistical issues because I needed to comprise this May 1st to September 22nd month for 4 months that we're receiving funding, but I was not able to provide Josheili, like some active mentoring. She has been part of the team in many aspects, but not that active as I really wanted if I would have the diversity supplement. So now we're doing a little bit of catch up in terms of those activities. One important thing for faculty to consider is that all the funding support, and I think this is great, goes to the, and I'll stop sharing now, goes to the candidate, which I think is great. But there's no FTEs for the faculty. And I think this is in my perspective, this is the same amount of time and effort that you usually do when putting together an R21. So you have to understand that it is very time intensive in terms of helping your candidate to get this award, and you're not getting the FTs. I would say that I don't have problems with my FTs, but I understand that our faculty, they have some issues with that. So I think you have to balance that when applying for this type of award. But in a way, we're very happy to have Josheili receiving this award. and helping her with her career in the next year. So thank you so much, and I will handle now to Sophia. Sophia.
Thanks, Dr. Calo. Yeah, that was a very comprehensive assessment of diversity supplements. So I won't go into that detail. I'll more talk about my program or my application. Let me see here. Share screen. So, are you seeing PowerPoint? Do I need to do screens at all?
We are seeing your slides, but not in presentation view. But we can see them okay if you want to just use that.
I will use, I'm getting this error that Zoom has quitted unexpectedly, but I don't think so. I don't think it's all right. Let me swap. Okay. Is it now?
It's still in the kind of PowerPoint mode. There you go. Yep, perfect.
Now, okay. All right. So, first I'll discuss my training and pathway to research independence, and then I'll discuss the process of applying for a diversity supplement through the National Institutes of Health, and then I'll discuss lessons learned, and provide resources if you're interested in applying for a diversity supplement. And so Dr. Jonathan Foulds was my mentor through the diversity supplement. He received a UO1 from the National Institute on Drug Abuse of the National Institutes of Health. And so one of the things that I was responsible for doing was doing some type of analysis. So my career development goals were to expand my knowledge of biostatistical methods, enhancing professional development through publications and grant writing, and then learn more about the responsible conduct of research, and finally develop a career development plan basically for my next career trajectory. And so here is one of the things that I think is very important, is to have a plan. So starting from my undergrad studies, it was focused on African American studies and public health, onto my master's degree in healthcare management, and then doctorate in public health and epidemiology, onto working at the Pennsylvania Department of Health in their tobacco control and prevention program, and then getting a postdoctoral fellowship here with the Pennsylvania T-Corps. We're now T-Corps 3.0. So we now got that award again. So that's a great accomplishment. And then onto the NIDA Diversity Supplement. And I did receive the K Award right after my postdoctoral fellowship. And in a couple years, hopefully apply for an R01 to focus on health interventions to eliminate tobacco-caused health disparities. And so this kind of outlines, what my pathway was, and was very helpful in sending it through my K Award. I don't think I put this in the diversity supplement. But the Parent Award, which is Dr. Foulds' grant, was the switching to nicotine-containing electronic cigarettes reduce health risk markers. And so the original application was to recruit a cohort of 240 exclusive daily cigarette smokers, and to measure, do a whole bunch of different measurements of health markers at baseline, and then at 3 and 6 weeks, find out if, just assess their attempt to switch to a standard research electronic cigarette. And so there were 2 different types of e-cigarettes, one with 0 nicotine in it, and then some with 15 milligrams of nicotine in it. So we have that placebo control randomized double-blind design. And so the goals for my diversity supplement were to analyze the social and economic factors that influence clinical trial enrollment and to see if those same factors were responsible for people switching from traditional cigarettes to e-cigarette. So hopefully we were looking at a hypothesis of smokers' social determinants of health-related risk and how it influenced the enrollment, retention, and ability to switch from traditional cigarettes to a Shrek is what we call it. These were my specific aims. So we had aim 1 with 2 different parts. One was looking at the overall looking at social and economic factors that influenced enrollment and retention in that parent grant. And then the first portion was to examine the association between social and economic factors during screening and whether they would enroll or not enroll. And then examine the association between social and economic factors and study retention at week 6 using an adapted PREPARE instrument. And the PREPARE is the protocol for responding to and assessing patients, assets, risks, and experiences. And so aim 2 was to look at examine the association between the social and economic factors, and then also looking at the end of the trial, what were the tobacco use behaviors. So did they use no cigarettes at all? Did they have dual use of an e-cigarette and a cigarette, or did they just only use cigarettes at week 6? And so I have a sample of questions for the PREPARE. So the PREPARE was originally developed by a group of organizations, one Kaiser Permanente and community health centers. So they developed this assessment tool, and it's grown considerably since they first initiated this. And what my assessment tool was looking at is also including adverse childhood experience questions within the questionnaire, in addition to standard tobacco questions that we ask in our clinical trials. So the domains here on the left, this is just an example of some of the questions. We have the different domains, which are the social determinants of health as defined by Healthy People 20, it's not 2020 anymore, Healthy People. We have the economic stability. So looking in the past year, have family members you live with been unable to get any of these needs. So looking at food, clothing, utilities, childcare, medicine, transportation, were you able to get to your doctor's appointments? Do you have a phone available? And then if there was something other, they could write that in. Looking at education and early childhood development, this is where we input the adverse childhood experience questions as well. So in addition to looking at the level of education that people attended, also were your parents incorporating the adverse child experience questionnaire, were your child separated or divorced? Was there someone in your household that was incarcerated? Do you feel safe where you live? The social and community context, looking at how often do you talk to people that you feel close to, how many times per week, 5 times per week or more than 5 times a week. Health and healthcare, what's your main insurance, looking at that, and also neighborhood and built environment. Do you physically and emotionally feel safe where you currently live? So incorporating all those tools into the clinical trial was one thing that we're still actually collecting. We had some delays with that study, so we're actually still in a process of working on that study. And we had to reduce the sample size considerably partially due to recruitment issues we're experiencing. But so it took me about 5 months for that first diversity supplement to come through. This is the timeline of that process. The first application was submitted in December 2018. And then we received a summary. Just a note about diversity supplements is that they don't go to the full NIH review process. There's a committee at the Institute where you submit the application that actually reviews it. So that's the positive part of diversity supplements, is that they don't take as long to get approved. And they're also within that institute where you submitted the application to. So They reviewed it. They sent me a summary. I responded back to them the next month. And then the month after that, the notice of award was received. So in contrast to Dr. Calo's application, mine went pretty quickly. Also, the budget period, it began a couple months later, and then showing here the diversity supplement when that period ended. So when that period ended, I did also receive another second diversity supplement from November 2020 to July 31st, 2021. And at that point, there was a lag in funding for me, but luckily I had submitted part of my career development plan was grant writing. So my mentors were responsible for helping me to write a K grant. So that was successful and was awarded in January of 2022. I do want to note that I also did have additional mentors. So Jason Lau helped with the biostatistical piece, and then Dr. John Ritchie, who passed away recently, he was also one of my mentors on this diversity supplement. So I would say the format for submitting the application was similar to what Dr. Calo had explained. There is, as you go up the different levels, so from like high school to doctoral student to postdoc to early career principal investigator, you do get a considerable different amount of funds, but I would suggest you read the announcement that comes out from the institute that you're applying to make sure you're familiar with all of the application process and the amount of funds that you may receive. Again, the UO1 was a 3-year grant. It wasn't a 5-year grant, so there had to be enough years left on the grant for me to apply for this diversity supplement. And I'll go on to my next slide. So my lessons learned is to start your application as early as possible, because whatever happens, that could go wrong, probably will happen. Luckily, Dr. Calo received a diversity supplement at another institution, so I was able to look at his application he had submitted, and that was helpful in completing my application. Talk to other individuals who receive diversity supplements. I'm open to providing my application information that I submitted as well. So you can definitely contact me if you're interested in doing that. Read instructions carefully, like I mentioned before. Search NIH Reporter for applications that have been awarded. So they're usually designated with the S1 at the end of the grant number. So if you go to NIH Reporter and you search that database, it shows you the different different supplements. So they're administrative supplements. These that we're talking about are specifically for diversity, but there are other supplements you can add to a larger parent award. You can watch NIH videos on YouTube, NIH grants and NIH Institute on Aging. They have some great videos on completing diversity supplements. And the resources that I used, because there weren't a lot, that I found where you can find actual applications or actual ways on how to fill it out. It was the Icahn School of Medicine at Mount Sinai and Duke University. They had a webinar where people from NIH actually presented on diversity supplements. So these are the links here to those resources. And that is my presentation. So I'll take any questions.
Well, thank you very much, both to Dr. Allen and Dr. Calo. And Josheili, thank you for joining us as well. The floor is open for questions, so feel free to go ahead and ask your questions or put something in the chat if you prefer.
Hi, can I ask a question? First of all, thank you so much for presenting this. It was really helpful to see the process for both. And I was wondering if you would be okay with making the slides available to the Graduate Education Office, so we can have them as a resource. We have had at least one diversity supplement submitted from the immunology department, but it would be useful to have your experience as a resource. So let me know if that's something you're comfortable with doing.
Sure, I can share my slides. And I know this presentation is being recorded, so
Yeah.
that will be another resource. Also plug for October 31st, Amplifying Lion Voices. If you're interested in learning more about me and my background, I'll be talking with Dr. LaQuise on the 31st about my background and going through my research trajectory.
Good. Yeah, not only I'm happy not only to share my slide, but also my diversity supplement as well. I want to mention one more thing. Sophia mentioned that when she was applying for her, I shared a prior diversity supplement that I received when I was a postdoc. This is the fun thing, and it's quite important that diversity supplements cannot be transferable from one institution to another or from one person to another. So when I was a postdoc at UNC Chapel Hill, I was finishing my T32, and I was a little bit worried about the prospect of finding a faculty job at the time. So I decided to work with my mentor because my T32 was just coming to an end. So I applied to diversity supplement, and at the same time, I was just applying for faculty jobs. The diversity supplement, when it came, I already have a job offer from Penn State, and I accepted my job offer from Penn State. You cannot transfer the supplement from one institution to another. And even the supplement was for me. If I want to transfer here, it was a supplement for a postdoc training, not for a junior faculty. If I wanted to get my diversity supplement, I needed to apply for another diversity supplement at my new institution, Penn State, as a junior faculty. So I think that's quite important to know that if you are a candidate and thinking about moving a different career stage, because you will be moving or maybe moving from one institution to another, you cannot transfer that diversity supplement. So I think that's quite important for you all to know.
Thank you for explaining that, Dr. Calo. And clearly, you made the right decision in starting at our excellent institution. Dr. Hanau, I see your hands raised.
Thank you. And first, I want to say felicidades to Josheili. Es un placer tenerte aquí.
Muchas gracias, doctora Henao.
The question that I have for William and Sophia is probably the same why Daniela is also here, is I want to know, we as an institution, how can we make this resources more available, so that how can we increase the T32s or the diversity of the grants, so that we can increase more diversity, but also the retention component. So what are some of the barriers that you see that we can work on?
I mean, one initially, so when I was searching for filling out an application, I think we should have a website dedicated to that for Penn State, so that we get in that search field. If we are able to make this webinar live and on the website so people can search it and view it, so that it's knowledgeable. I think just marketing and communications, I love marketing and communications because they're so important. I think just promoting it more on our website and our social media.
Can I add something here? So actually in the graduate office, we are talking about streamlining the process for PIs to submit diversity supplements for their trainees. And I'm familiar with the graduate student diversity supplements, but not so much with the postdoc. So this was new and very informational to me. So one of the things that we would like to do is to put a link on the graduate education website that oversees both graduate students as well as postdoctoral fellows. And maybe we can figure out to work with Inhinia and have that link be clear both from your office as well as from the graduate education office. And if you're okay with uploading some of the resources you shared with us, then that would be a way to start.
Yeah, that would be great. And also, I see Pamela is at the meeting here. Our website is going to go live soon. I think it's in a matter of a week. And so it will be great if we can work with marketing and communications on how to create a link so that if they were to, so that it's interconnected. Thank
I
you.
want to mention to Dr. Henao, to your question. Let me mention two things that we can do. Me from a faculty perspective. Number one, I sit down in the DrPH admissions committee. So I'm able to review applicants, and based on the responses, I can see, you mentioned, I noticed, my slides, I mentioned the 3 different criteria of backgrounds that I can identify to bring some of those potential diversity supplement applicants. So I have access to that information, because I spend the time working with our admissions committee. Okay, so I have that knowledge. Maybe we have to make sure that in all departments, in all academic programs here, we made the admissions committee aware about these opportunities. And we also are aware about the other grants that are in our own departments. Okay, my case was very easy. I have an R-level grant that qualifies, identified Josheili. I knew Josheili has a strong background in cancer prevention and control. So it was a perfect match for me to bring her here. And the very first time that I interviewed her before she started the program was, we're going to be working on a diversity supplement. That was very clear to me and her as well. I think we have to do a better job at the admissions committee in all academic programs. Okay. And the second thing is that, as I mentioned, you as a faculty, you don't receive FTEs. And this is like putting together another grant application. As Sophia said, yes, it's reviewed internally at the agency level, but it's like writing another grant application. You have to not only your 6 pages, but at the same time, you have to, if like Josheili, if it's involved the interviews of human subjects, in this case, providers, you have to submit all revised document for human subject sections. And those are a lot of things, bio sketches for all the mentors and all that. So it's like submitting an R21. So it takes time and effort for the faculty to put that together without receiving FTEs. And for some of our faculty, collecting FTEs is quite important. So I think we have to develop a College of Medicine wide frame to support those faculty, because it's time that they're putting for doing that. I'm doing that for Josheili, and I hope to submit another one next year. Okay, but I think we need to better support our faculty in that way.
Great, thank you very much.
Thank you. Can I add something about the admission? So thank you for bringing this up. I want you to know that I've been on the BMS admissions committee since last year when I joined. And at least for BMS in the admissions portal, we have a number of questions, including asking the applicants to self-identify as being part of an underrepresented community using the NIH criteria. And we list exactly those criteria that you had on your slide. And I put in the chat that Kristen Smith, who's the director of graduate admissions, has access to all this information. Now, all of this is a little bit up in the air this year because of the SCOTUS decision. And currently, the graduate school is going to be blinding this information to admissions committee. But you're right. I think admissions committees need to know and need to look for these applicants that increase the diversity. And I can tell you that at least on the BMS side, we are paying attention to that, and we can streamline that to make it more uniform.
Yes, thank you, Dr. Lucas.
Just a quick comment. Thank you again, William and Sophia, for sharing your process. And I missed some of it because somebody came to my office in the middle of it. Anyhow, I think you're right, William. I think if we want to continue to increase diversity, we need to look at what has been successful. Like, you bought a sample that you presented, if this is like almost like a template, if this is how we're supposed to do it, let's keep doing it the same way so we can getting more grants to support some of the students and to support other people coming to Hershey that way. But at the same time, I was going to add to what Danielia was saying about, the grad school is looking at, they're going to blindside some of this information because of SCOTUS. And now the question would be, how do we still go about identifying those potential faculty students who might be able to benefit from this kind of grants, yet we cannot directly ask them unless they self-disclose it without asking them. So that we need to find different ways of strategic way to get that information, let's put it that way, and still be able to provide, support the students as they come in. I just want to leave it at that.
Any other questions that folks have?
Can I respond to the last suggestion? So
Sure.
I think it's a great idea, especially given the SCOTUS decision, to change. I realize it's not possible this year, but for next year, to change your admissions questions and include questions that encourage the applicants to tell you about their background, to tell you about their challenges, to tell you about themselves in a way that you can identify these students that come from diverse backgrounds. So for BMS, what we did this year, before the graduate school implemented the changes, we added a few questions, and we're happy to share how we formulated those questions in order to get this kind of information from the applicants without asking directly the questions that are will be blinded to us. So that's one way. And then I don't know if on public health sciences you go out to different conferences, but on the BMS side, we are represented at different conferences around the country where students from underrepresented backgrounds come and participate. So we identify them in that way and encourage them to apply. So that's one avenue.
Thanks. I want to keep us on diversity supplements. So other questions for folks? Yes, please.
Yes, thank you so much for this. It was very timely because I've had a diversity supplement on my radar. I'm an assistant professor in the child clinical area at University Park. And one thing I've just been kind of trying to think about is kind of the role of the diversity supplement in an individual's career trajectory. Sophia, is really helpful to see kind of what yours was. Do you have thoughts in terms of the idea of like an early career faculty kind of pursuing this? I could see both the pros to it as well as potential cons to it in that, for me, I'll say that I was coming straight in from graduate school. So it's nice to have like a period of time with additional mentorship, but also not having a huge portion of funds that are allocated towards the research project itself makes it difficult to I guess, carve out something that's very uniquely mine. And so trying to think about that while also considering kind of tenure prospects and developing my own independent line of research. So I'm not sure if you guys have thoughts in terms of the idea of an early career faculty, pursuing this, or if you feel like this is better suited really for graduate students and like postdoctoral fellows.
I think it's great for anyone pursuing. The thing with the faculty is that you would need like a R01, you would need a large grant in order to get this done. So you would be on someone else's grant, is my understanding of R01. So say you went through postdoc and all that, and you really aren't familiar with research or whatever you want to learn more about, you want to get more training in that particular thing. I think a diversity supplement is just short enough time where you can get additional training. It makes PIs look great to NIH that they're supporting underrepresented people in research. In addition to those with disabilities, that would be also a great thing when going forward with doing an R01 later on in your career. So I think this is really meant for keeping people in the research career field. That's one of the things for it. So it's for early career, high school people who are thinking about it. And I will say this, and this is kind of like a sneak peek of my talk with Rafi coming up, but I started in high school in research. And this was from my guidance counselor. So, I mean, I think Penn State is getting to this point where we need to talk to high school students, maybe even middle school, like getting them thinking early about research and science. So as an early career, because I'm an early career PI, I don't think NIH is expecting me to do a diversity supplement, but in the future, because I was part of one, when I get an R01, this will be something I'll definitely will do, because they just want to keep you in research. And they don't want you to fall out, because of course you can get paid a whole bunch more money in private industry. But I mean, we need to do research, and it's so needed. All the great ideas people will come up with and topics for those in underrepresented populations. And, you know, allies and other groups are doing a great job as well. But we need to, you know, I guess, amplify our voices as well in research. So.
That was a beautiful answer, Dr. Allen. Thank you for that. Dr. Calo, anything to add to that comment?
Not to that comment, but last thing that I want to mention is that, and going back to Dr. Henao comment about what else we can do, there's another thing that we can do. And is that at least in my department in PHS, we have 3 doctoral programs, and we offer full GAs to the top 4 candidates at each program. So we only fully support those 4 students for the first year and a half. I have not been in this situation, but I think we're getting so many good students that the difference between the 5th, the 6th, and the 7th candidate is so close. So we're losing really good candidates because we're not able to fund more than 4 at a time. If I identify a person that is in the 5th, 6th, or 7th that I can bring as for a diversity supplement, I think we should have like some kind of a college funding that me as a investigator with the capacity to submit a diversity supplement, because I have my R or my U mechanism, I can go and say, I commit to submit this diversity supplement in the next year. Please help me getting this student coming here. So I can get some GA for that person for the next year. And then I do as I did with Josheili, submit it on November, and then get the award in September and all that. So I think there are other options to increase our pool. And in my case, PHS, we have so small number of GA positions. So that is another factor that may limit our capacity to attract those type of people.
Great, thank you. So it's almost like a bridge.
Yeah,
Okay.
yeah. Yeah, because ideally you want to have that students to know here, maybe have one publication with you, and you know, take a couple of classes and make that diversity supplement happen. It's not, again, it requires writing a grant. So you need some time commitment for that student as well, that if they supported that first year would really help.
Excellent. Well, I want to give the last 3 minutes to our amazing panelists. I want to start by thanking you for an excellent session. Any closing thoughts that you 3 have that you want to share with the group?
Wishing everybody the best of luck. Don't lose your encouragement and keep on doing the amazing work you're doing. As Dr. Calo and Dr. Allen mentioned, diversity supplements truly help us a lot for career development. To me right now as a growing researcher, and to Dr. Allen as an already amazing researcher. So just keep your head up high and let's keep on rocking it for our communities.
Definitely. And I would give a plug also to the postdoc office. Part of my diversity supplement required career development, and our postdoc office already does that. So all I had to do was say, okay, I have a career plan through our postdoc office, and then continuing on to this diversity supplement, I intend to continue with that. So shout out to, I don't know if Gail Thomas is still head of the postdocs, but Kirsten Eckert, she's already doing amazing things now with CTSI and Penn State Cancer Institute, but she was a director when I was coming through as a postdoc, and she was a great help as well. So just keep on supporting our young and up and coming, I want to say young, I say early career, our early career researchers, because they need everyone's support.
And for me, I'm happy to chat with any of you individually and help you identify potential candidates and share my materials with you, so we can improve our recruitment and retention of talented diversity supplement applicants. Thank you so much, Jen.
Yes. Thank you all. And I can say stay tuned for more from the CTSI in this space. We have a lot of resources that might be helpful if you're thinking about this for connections, whether you're on the side of someone who wants to write these and is looking for a match make with maybe an early career faculty or postdoc in that space, or you're on the trainee side. So that's exactly why we're launching this effort under our new amazing director of JEDIB. Thank you, Rafi, for joining us today as well. And thank you, Dr. Allen, for the shout out for your kickoff for our Amplifying Line Voices seminar. I hope you'll join us for that as well. Have a wonderful week, everyone.
Bye-bye.